Ajahn Joseph Lancaster and my dear friends, very good morning. I am Virawat Udomwarakunchai, a fourth-year student from the Department of Chemical Engineering. 10 years ago, my grandfather suffered from the final stage brain cancer. Even if her conditions were very severe, my family still decided to prolong her life by means of chemotherapy. I had no idea how much pain she had to endure. 4 months later, she finally died. And now at this time, I have a very big question in my mind. Did she really want to have her life prolonged? And that inspired me to come up with this topic, euthanasia. Do we have the right to die?
I don't want to go home. This has been the best. You're glad you came, right?
You know what? This is one of the best movie ever I have ever watched. It is one of the most heart-touching one. Like every time I watch it, I was about to cry. So does anyone here know from which movie this video was from? Yeah, it's from Me Before You. Will Trainer, the man on the wheelchair, suffered from a motorbike accident, and this accident left him quadriplegic. He has to endure countless pain. This accident cost him a lot. It cost him his girlfriend, it cost him his home, it cost him his old life. So at the end, he went to Switzerland and end his own life. So, what is euthanasia? Basically, euthanasia is just what Will Trainer did at the end of the movie. Euthanasia is the practice of ending one's life by any means. So the act that Will went to Switzerland and end his own life is a type of euthanasia. So the topics that I will cover today include types of euthanasia, significance of euthanasia and its statistics, and case studies. Active and passive euthanasia are the first two types of euthanasia. Active euthanasia is a death that is brought by an act. For example, if you take too high dose of drugs and you die, that is considered active euthanasia. And for passive euthanasia is a death that is brought by an omission. For example, if you have a grandma and she is having a very severe disease, you decided not to carry out the surgery that would prolong her life. This type of euthanasia is called passive euthanasia. Euthanasia also can be categorized into voluntary and non-voluntary. Voluntary euthanasia happens when patient is conscious and it's his own will to euthanize himself. For example, as you can see from the movie, Will Trainer decided to end his own life. This is considered voluntary euthanasia. However, involuntary euthanasia happens when that patient is unconscious and an appropriate person takes that decision instead of him to euthanize the patient. This is considered murder, and however, it is illegal in most of the countries. And the last two types of euthanasia are assisted and indirect euthanasia. Assisted euthanasia happens when a patient asks for help to euthanize. For example, you can go to see a doctor and ask the doctor to give you a lethal injection and then you die. This is a type of assisted euthanasia. However, indirect euthanasia happens when the side effects of the treatments you receive shorten your life. So Now at this point, I think that everyone may be wondering why euthanasia is so significant. So let me prove to you in a minute. I believe that everyone has a freedom of choice. We have the right to do. We have the right to go. We have the right to select. So why don't we have the right to die? I think that everyone should be given the right to die. And euthanasia provides a way to relieve extreme pain or when a person's quality of life is low. So people should not be forced to stay alive. But however, euthanasia is still controversial at some point, which is why I have come up with this question. Has euthanasia been legalized? The answer is yes, it has been legalized, but only in some countries. Blue region in the map on your right hand side represents countries where active euthanasia is legal. These countries include the Netherlands and Belgium. And the green region on your right hand side represents countries where passive euthanasia is legal. These countries include like France and Spain. And the yellow region represents countries where assisted suicide is allowed. To remind you, assisted suicide is when a patient asks for help to euthanize himself. So these countries include the Switzerland and Germany. However, in Poland, euthanasia is illegal. So let us see some of the people's opinion upon euthanasia. This was from a poll of 1,001 Americans who were asked if they would support or oppose euthanasia in the United States. Positively, 42% say yes, and 22% was unsure, while 37% opposed euthanasia. And this was another poll of public who support euthanasia for the terminally ill, which means the patients that cannot be cured by any means. Positively, 86% support and 14% were against. Let us see some of the one of the case studies I would like, which is very interesting. I would like to share to you. This guy is Craig Ewart, an English college professor who suffered from a motor neuron disease. This disease led to the difficulty in gripping, walking, swallowing, speaking, and breathing. So he could not do anything properly. This guy said that he would die rather than spending the rest of his life in a living tomb. So he went to Switzerland and ended his own life. So what we have covered today are types of euthanasia, significance of euthanasia, and its statistics and case studies. So I have two little thoughts to share to you for this presentation so that you can get something out of it. So the first thought is, before prolonging one's life, think twice. You have to think carefully because it's their rights, it's their life. So you should let them decide. You have no idea whether he or she really wants to have his or her life prolonged. So think twice. And the other thought is that to save a man's life against his will is the same as killing him. So be sure that in that extended lifespan, he or she does not endure countless pain. He or she will be better. But most of the time when you extend someone's life, they are going to feel worse. So euthanasia may be one of the best options for you to go for. So thank you everyone. Thank you for your attention.